Hi there. Today we're going to talk about a topic that really excites me. It's not actually medicine, but it's how we deliver medicine. So I'm going to talk about direct primary care, or DPC, and talk about what it is and why it's amazing. So if you already see me at my practice, you're going to hear me talk about why my practice is awesome, and you already know this. But if you haven't, listen up, because this is a way to have the kind of relationship with your doctor that you want and deserve.
What? Did we just become best friends? Yup!
The concept of DPC is really built around the idea of having a model of healthcare that restores the doctor-patient relationship. I say doctor all the time. It might be a nurse practitioner or a PA that you see. Healthcare provider is probably what I should be saying, but I say doctor because that's what I am. So don't be offended if it's not an actual MD or DO that you see. But the whole concept is that medicine is turned into something that it was never really intended to be, where people are hurried. Doctors don't have enough time to spend with their patients, and so that's who falls through the cracks, is the patients.
Wait a minute! Who are you?
In a DPC practice, our panels are much smaller. For instance, when I left my job in the big healthcare system, which I'm not bashing them at all, I was very happy when I worked there. This just seemed like the right thing to do. So, little sidebar there. When I left, I had nearly 3,500 patients. Now, I'm a busier DPC doctor, and I have a little bit over 900. So, I'm not trying to take care of everybody in town. I have a much smaller group of patients. Instead of trying to see between 25 and 35 patients a day, I'll see 5 to 10, and on a busy day, maybe 15. One of the big differences to patients is that instead of a one-issue office visit where they may have 5 to 7 minutes with me, all of my appointments now are 30 minutes or an hour. And I can assure you that is plenty of time for us to do what we need to do. Most direct primary care, or DPC practices, when I go into saying DPC, it's just easier and takes less time. Most DPC practices don't take any kind of insurance. It is a membership-based model, kind of like a gym membership, but for your health care. Your health care is the most important asset that you have, and you need to take care of your health. It is totally worth the investment, and I don't think you would ever regret it. My patients say, I just can't imagine ever going back to the old way of doing things, which is kind of a funny thing, because DPC is really like old-timey medicine meets technology. Patients have more access to us. I'm actually the one that sends result notes to my patients, which I did not have time to do in my old job. When does your doctor pick up the phone and call you with something, or send you a personal email about something? Well, in my practice, it's every day. And we also get to practice common sense-based medicine. So, being a family doctor, I often take care of all of the members of the family. So, on a weekend, my patients can text me and say, hey doc, you know how you're treating little Jimmy for strep throat? Well, I woke up today and I think little Jimmy gave me his strep throat. I have sore throat and a fever, and I looked in my throat and it's red and covered in pus pockets. Well, you're right. I think you probably have strep. And so I can treat that person, and they have just saved a visit to urgent care where they're going to pick up more germs along the way. Also, if someone needs a phone visit, maybe they don't need to come in to adjust their antidepressant medicine. Maybe they can just send me a message, or we do a phone call where they say, hey doc, here's how I'm doing, bam, bam, bam. I think we might need to adjust the dose a little bit. We can do that without having to drag them into the office. They don't have to take time off work, and they're able to address their things in a more flexible way. Most DPC practices don't have co-pays for office visits, which is lovely. You know what you're going to pay every month for your membership fee. Then when you come see me, you don't have to budget any extra money for that. Why would I do this if I already have health insurance? Well, I would ask you, What's your deductible? Do you ever come close to meeting that? Most people, most years, won't ever come close to meeting their deductible, so this is a much lower cost than going into the doctor enough times that insurance starts picking those up. What's your copay when you go to the doctor? Is it $35 or $50? Most DPC practices are $100 or less per month per member, so a couple of visits and you've already made that up. Also, how long does it take to get an appointment to see your doctor? 4 to 6 weeks. At most DPC practices, you can have a visit same day, next day, or certainly within a few days.
It's been 84 years.
I could go on and on and on, but we've just scratched the surface today of direct primary care. We'll have more segments in the future, but I thought I'd plant a few seeds today. Like and subscribe. Stay tuned for more.